So I find my point, release, recontact, and at first I go inferior vector, directly inferior, parallel to the coronal plane, which is the table. The three planes in anatomy are the sagittal plane that separates right from left, the coronal plane that separates posterior from anterior, front from back, and the transverse plane that separates superior from inferior. Okay? So directly inferior is going to be along the coronal plane. So when I find my point on the zygomatic bone, I go inferior for 30 seconds, I release, recontact, and go superior for 30 seconds. Then, on a line directly toward the auricular canal, the hole in the ear, I go one soon, and I'm going to find the treatment fossa. Fossas are depressions in the bone. I'm going to find a little depression, a little fossa right there for the sphenoid bone. Again, I'm going to release, recontact, inferior for 30 seconds. Release, recontact, go superior for 30 seconds. Okay? Now, if I go to complete an equilateral triangle between the zygomatic and the sphenoid, the third point will be the perfect fossa to release the temporal bone over the ear. It's important that the cranial plates open and work in conjunction to deal with migraines, tension headaches, cluster headaches, all of the headaches, sinus issues, and allergies. So again, I find my equilateral triangle, inferior for 30 seconds, release, recontact, superior for 30 seconds. If I go back to my original frontal release point, and I continue along a parallel line, and I find a fossa just up from the table is going to be the inferior fossa for the parietal bone. Okay. Inferior for 30 seconds, then I'm just going to slide parallel to the table or coronal plane, because I don't pull her hair to get my superior release in the parietal bone. I have to come around the parietal ridge, a little ridge in the side of the bone that will give me purchase, a place where I can apply superior pressure. Okay. Then I'm going to do 4 nasal points right where the nose meets the face. 4 individual points, all of them on the bone, not on the cartilage at the end of the bone, but directly on the bone. Okay. I'm putting no pressure on her eye directly. The vector for the sinus points along the nasal bone is directly toward the sagittal plane. I'm going to do 30 seconds on each of the 4 points. Then I'm going to do my points on the superior aspect of the orbit, the bone above the eye. I'm going to lay down all 4 fingers. Now, at the beginner level, we just do neutral vectors toward the center of the bone. At intermediate, I'm going to rotate at each point I find a subo, because in advanced Shiatsu, we do an LVPD for every point we touch on the person. A location, a vector, an accurate pressure, and a duration until we feel that yang block subo open. After doing the superior aspect of the orbits, I'm going to do the inferior aspects by taking the edge of my 1 or thumb, laying it across the orbit, and rotating till I find the yang block subo. Find an LVPD for each point. After I feel that open, I'm going to go on the inferior aspect of the zygomatic bone. Okay. Cupping around, it's approximately 4 points there. Then I'm going to do the maxilla, superior to the upper lip. And then I'm going to use cup between my fingers to check the mandibles, all the way up to the temporomandibular or TMJ joints. Many people have TMJ problems. Their jaw may click, pop when they eat, or they may be able to shift it sideways. This has a lot to do with allergies and headaches. Okay. Now, if she seems to have some tension in that TMJ joint, I'm going to ask her to slowly open her mouth while I watch her mandible, her jaw, as it opens. Because what will happen is the jaw will open and then it will shift to one side or the other, where I'm going to need to cross-fiber to look for where that shift is to be able to deal with her TMJ issue specifically. Okay, would you open your jaw slowly, please? And close. Okay, now when her jaw shifts, the second time I do this, I'm going to ask her to just hold that point. Okay, so you open again slowly, please, and pause right there. Then I'm going to cross-fiber around the TMJ joint until I find the subos deal right with where the imbalance started to manifest as she opened her jaw. Rotate again on each point. Now, what you do as students is you make a full rotation. Okay? When you do this a few million times, you'll be able to get to it quicker. But in the beginning, make sure you make a full rotation. Okay. Then the ears are very important. Check for jewelry. Don't crush an earring in between your fingers. It's very uncomfortable. Okay. Now, you can't ask them to take all their jewelry out, or you learn to work around it. Some people have a lot of jewelry and they don't like to take it out. There's no reason you can't work around it if you're careful. This is kanbiki with the hand. We talked about a whole kanbiki where you put down your fingers, drop the base of your thumb, lean forward, and then twist. A lot of areas of the body, we do a kanbiki just with the hand itself. We put down the fingers, and then we lean, actually lean with your body weight, and close the distance with your thumb, and then twist. Okay? And that's what I'm doing right here with your ears. In Chinese medicine, there's an entire body map in the ears, the hands, the feet, and the hara, or belly. Okay. Now, one of the fun things with students is the next point we're going to do is the sinus clearing or qi exchange. Rub your hands together. The more the students study, the warmer their hands get. In the beginning, they're kind of tepid, they're kind of cool. The more they study at the end, after you get up to the intermediate level, you can almost light paper with them. Then I'm going to slide around to the shoulder. Okay, we have the clavicle, comes over and meets the acromion process of the scapula for the AC joint. We have the humerus, comes in and meets the glenoral articulating fossa of the scapula to make the glenohumeral joint. Okay. So in beginners, we're going to separate three lines on the posterior aspect. Remember, in anatomical position, in Eastern, it's palm forward, arms up. Okay, so the dorsal surface or back surface of the hand and arm go with the posterior, the palmar side with the anterior. Okay, we're going to have a couple of rotations. We're going to learn about joint rotations. And the entire purpose of joint rotations is to help us find mini zones quicker. As we rotate a joint, it will move smoothly, and then it will come to a point where it feels thick or rough.